Okay, everyone, welcome back to the Period Chats podcast. We are so excited to have Dr. Oh my gosh. Okay. It's like I haven't recorded a podcast in 2 weeks and I feel like my brain is like,
Yeah. Oh, girl, it's all of us.
okay. Hey, everybody, welcome back to the Period Chats podcast. We are so excited because today we have Dr. Casandra Wilder with us, and she is going to be talking about all things PCOS or polycystic ovarian syndrome and other hormonal imbalances. So I'm going to turn it over to you and you can introduce yourself to all of our guests.
Thank you so much. I'm so excited to be here. And as you said, my name is Dr. Casandra, and my passion and purpose in this world is helping women reclaim their cycles and rebalance their hormones, because it is a sad misconception that periods and hormones are just meant to go awry and that there's nothing you can do to support them. Like many women, growing up, I had irregular cycles, painful periods, and I remember being told at a very young age that the only fix, and if you can't see me, I've got air quotations, the only fix is birth control. And I was maybe 18 or 19 years old, and I remember thinking, that's it? Like, that's the solution you have for me? That doesn't make sense to me, and I'm no doctor. And that really set me on this journey to figure out, why is it that we have this idea that hormones are so mysterious and no one knows how they work? Why do we feel like women's cycles are just meant to inherently be painful and be full of problems, from acne to things like PCOS? Why do we just continue to normalize something that no woman deserves to go through? So when I went to naturopathic school, that was really like my fire under me to start to look a little deeper at the research. And I have to tell you, it was kind of the kind of stuff that boils your blood a little bit when you start to see how women have been left out of most research studies around exercise, nutrition, even pharmaceuticals, because there's this idea that women of reproductive ages have just too irregular of patterns. Their hormones just make things too complicated for us to really measure. So just leave them out, and we'll hopefully this information still helps this population we didn't test. So I know that's a bit of a tangent, but I say that to demonstrate that there's a huge gap in our approach to medicine. And so as a naturopathic doctor, I feel so grateful to try and bridge the Western approach and also maybe more of the natural holistic modalities, because I think we have to talk about both. Both have their time and place, but we need someone to kind of like communicate between the two and show women that there is a way to balance your hormones. You don't have to live with painful periods. And I think it can be really empowering, in fact, to take your health into your own hands.
Yeah, that is so amazing. And it's so interesting to me. It's amazing to get to connect with all these different periodpreneurs or people who are really passionate about women's hormones, because it is something like, I'm a dietitian. I was in school forever, I feel like, learning about the body. And I was always simultaneously struggling with these horrible cycles and birth control. And it's just crazy what we don't know. I think we could do a whole separate podcast on the fact that we're left out of research, which
Right.
that is something that boils my blood, because I think it's something like 26% of the global population is currently menstruating. So that's a huge gap, but we're happy that you're doing the work and we're doing the work. And what I really want to dive into today is what we get so many questions on is PCOS. And I'm sure you see lots of patients with it and clients. So what is it?
Yeah, good question. So PCOS is called Polycystic Ovarian Syndrome, but it's pretty misleading to even call it that, because you can have PCOS and not necessarily have cysts. So there's a lot of people actually that are lobbying to change the name of it to more of like a metabolic imbalance. So at its core, what it tends to really root back into is more of an insulin resistance. So I can talk more about that in a moment, but it's kind of one of those diseases that seemingly has come out of nowhere. Even in naturopathic school, I really don't know if we talked about it that much, because it wasn't really an issue back then. And now they're saying that 1 in 10 or even 1 in 5 women will be diagnosed with this disease at some point, which I think is even more, it illuminates even more why we need to be having conversations like this and showing women that the traditional routes for management, if you go to your physician and like the solutions they give you are less than stellar, then they're not going to ever fix the imbalance. So we have to start pioneering conversations like this. But with PCOS, it's really rooting back from a number of symptoms. And even when you go to a doctor, they're really just going off of symptoms to diagnose you. So there's no formal testing to say you have PCOS. They may say that in testing your androgens, like testosterone, are high, which is why some people get, facial hair or acne, and even a change in their voice on a very severe level, to feel more masculine. Other than that, they're just going off of symptoms, which I think is important to note here. So that's why some people will be diagnosed and some people could have the same set of symptoms and never be diagnosed. There's kind of like no consensus, which is why PCOS is just kind of a mysterious, complicated disease to be diagnosed with, right?
Yeah, that's so interesting that there's no formal testing. And I actually didn't know that until I was doing a bunch of research, and they're like, "Oh, we're finally coming close to having a test." And I was like, "Wait, what?" Like,
Right.
there's no formalized testing for something that affects 1 in 10, maybe more, like
Yeah.
menstruators. So that's
Right.
insane. And you kind of touched on this, but what are some common misconceptions? So you touched on the cis part, which I hear a lot of. But what are some other things that people may get confused with PCOS, or that come to you and they're like they're confused?
There's so many.
Yeah, I know.
But like
That's
the three, if we have to boil it down, there's three really big ones that I see. So the first one is that if you have PCOS, you have to be on birth control indefinitely to manage it. So most of the time, if you go in, you're diagnosed by your physician, they will tell you that you need to be on birth control because otherwise your periods will never come and otherwise your hormones will go out of whack. Now, the thing that's really complicated about this is birth control at no level fixes a period problem. It is forever a suppressor of symptoms, right? I know, like, let's say it louder for the people in the back.
yeah.
So to me, that's a massive disservice to tell someone that already has some pretty severe hormone irregularities, maybe some insulin resistance, to go on something that's likely just going to progressively make the disease worse and never at any point fix what's really going on. That to me is not okay. These are also the people that will go on then to eventually want to get pregnant, and then they'll be told, oh, you have to do fertility treatment. It's one of those things that you wish at some point someone could have stepped in and said, maybe let's talk about what is going on within the body. Maybe let's talk about the hormone irregularities that we can test and can see and manage. So that's a big misconception. If you have PCOS, you don't have to be on birth control indefinitely. And I would even dare to say that's a disservice to yourself to just blindly follow that. So there are options. Another big misconception is that if you have PCOS, you're infertile. And that's not true. People with PCOS can get pregnant, but we do, again, have to look at that deeper root. Are we ovulating? And if not, how do we encourage ovulation to happen? And usually with enough hormone support, we can get someone ovulating again, and they can go on to have a healthy pregnancy and a wonderful birth and a healthy baby. And I think these kinds of things too root even to the beliefs that we carry. If we walk around believing that we're infertile and that we will never get to be moms, that's a really heavy thing to carry. Yeah, I don't think that's necessarily useful. The last big one I see is that people with PCOS are always overweight. And that's not true. There are people that look like athletes that are diagnosed with PCOS, but the stigma especially is not serving anyone, because there are people that are never diagnosed because the doctor looks at them and says, well, you don't look like you have PCOS. And so they go on having all these irregularities, no diagnosis, and they never get help. So PCOS can affect everyone of every size, of every background and ethnicity. PCOS doesn't have a look. So we can all let that go.
That is very important. And as a dietitian, I'd love to touch on that, because I get people who come in, like clients, and they're like, I've been told I can never have a carb again, and I have to do all these things and exercise constantly. And we almost have to step back because this stigma has been put around PCOS that no, there's no food that's off limits. We can try different things. Everybody's different. Like, there's not a one size fits all approach. Like, let's look at your lab work. And it's really sad because I feel like, and I read a stat recently that if you have PCOS, you're more likely to be diagnosed with a disordered eating pattern due to the way healthcare providers have talked to you, which was very interesting to me.
Yeah, because their only suggestion is, well, you need to lose weight. And the average person doesn't know what does that mean? So yeah, then like you said, they start to do the restrictive dieting that probably causes way more harm than good.
Yeah, that's a huge, I'm glad you touched on that. Like, it's all shapes, all sizes, all people. No one's immune,
Mm-hmm.
unfortunately. But yeah.
Exactly.
Okay. So then that spurs into another question. So it can affect anyone. So there's not one specific population, or is there any other like factors you look at when you're looking to diagnose?
Yeah, so in the diagnosis of PCOS, they want to see some of these key indicators met to formally diagnose you. So the symptoms or the things they want to see to say you have PCOS are things like the insulin resistance. So there's some sort of big blood sugar irregularity. It could even manifest into a full-blown form of diabetes. It's also the weight gain. So that can be a large indicator for some people. The acne tends to be a big part of it. The facial hair, those are like the more stereotypical ones, we think of. But then this also is things like cysts on the ovaries. They call it the string of pearls, where you get multiple really small ones along your whole ovary. High androgens, so high testosterone, but then also the irregular cycles is a really significant thing. People with PCOS tend to have, maybe a 35-day cycle and then a 45-day cycle. And when they do finally get their period, it's like a hemorrhaging. It's very heavy, very intense, very painful. And then it disappears again for another 6 weeks or something like that. So if you're meeting, say, 3 to 5 of those on that list, that's what would lead your average physician to formally diagnose it.
Okay. And then from there, so you test the hormone levels, and then is it more of like a diet and lifestyle management, or are there medications? Like I know everyone's different. And then how does insulin resistance play into that?
Right. So there's kind of two levels. There's like the Western approach, right? And then there's the more holistic, like you and I would believe in kind of approach. So if you follow the Western approach, their way of addressing it is largely birth control and medications. So they may put you on birth control to keep you having a consistent period. They may give you like metformin to help regulate your insulin levels. And then they may put you on things like anti-estrogen pills, things like progestin, which is a fake progesterone. And then they may give you like topical things to manage facial hair or manage the acne. But I think that's important to mention because I think most of us just intuitively can see that that's not fixing what's going on. Again, that's maybe just getting rid of the acne or maybe forcing us to have a bleed once a month. But at what point are we saying, what about like the longevity of this? So in more of a holistic approach, then yes, we're definitely looking at diet and lifestyle and also doing things like testing to look at what the hormones are doing. I really believe nothing in the body is random, right? The body doesn't just say, I really want to give you a really hard time this month. There's a reason behind it. So when we look at your levels, we may see that, yeah, testosterone is high and there's a lot we can do to pull testosterone down. And likely estrogen may be a little high and progesterone may be a little bit low. From that baseline, just by rebalancing your hormones, we can see a massive change. They say PCOS is incurable, but they also say that the symptoms can be 100% managed. So you can, make your own decision about what that means. But to me, that shows there is a huge level of healing that can happen. So yeah. And then especially with the blood sugar component, that's one of the most important things in terms of diet is rather than focusing on restriction or removal, focusing on the increase of good proteins, fats, and fibers. So by keeping your blood sugar regulated, yes,
Yes.
we can see a huge difference with PCOS. So I like the acronym PFF, protein, fat, fiber at every meal. So that makes it really easy. And I think we both agree that the restrictive way of looking at it, like you can never eat bread again and you can never eat pasta, like these things that are not going to be sustainable. Like no one can do that. At least I don't think I could do that. And the disordered eating patterns that creates is far more scary as well.
Yeah, because it's really interesting. Like when you get into those, I've done a lot of research around restrictive eating patterns and how they affect our hormones. And the blood sugar balance is actually something that's really interesting, not just for PCOS, but in general, our hormones. I mean, I have to admit, I even like stopped drinking coffee on an empty stomach. I made all these changes because I didn't realize how much diet and lifestyle can actually throw our hormones into overdrive. And then if something's already a little bit off, we have to listen to those cues. So I love that you don't take a restrictive approach because it's not helping anyone, in my opinion, which is just my
Amen.
opinion. I mean, everyone I mean, you have to say that, like, everyone's got a different approach, and healthcare providers do have like their best intentions at heart, but I think it's important to remember that when you restrict, like, we are not just like physical beings, we are mental beings too, and
Yeah,
restriction is something that triggers something in our brain to then overeat, binge, repeat. And you
exactly.
don't have that peace with food. It just is your enemy.
Exactly. Exactly.
So
Well
that's
said.
the holistic approach. From there, so like when you kind of start digging into these things, you do all this testing, you figure out how everyone's different. Would you say that is like really where the individuality of it comes in? Because like one PCOS case may not look the same as another. They could have a general similarities, but they're going to be very different, correct?
Exactly. And I'll be honest, some people are diagnosed with PCOS that probably don't really have it. It's kind of an umbrella term anymore for a pretty significant cycle imbalance. And then other people will probably have PCOS and never be formally diagnosed. So it's one of those things where I think, yeah, we have to be customizable in our approach. And as I say, it's never just one thing, right? No one just has painful periods or just PCOS. There's something more. Their cortisol levels are probably really high, or their thyroid's having some struggles, or they're also super mineral deficient, or like there's always more to the story. So yes, the testing I think is like the nice foundational part, so we can see what's really going on beneath the surface and then customize everything. So especially for people with PCOS, if they're just like, Googling how to naturally treat PCOS, you may find things that help, but you and your whole life experience are unique. And I think that's something that really needs to be, I think, spoken about more, that you're more than your diagnosis. That doesn't define you. And by working with someone and getting that full spectrum approach to your health, like that is invaluable.
Yeah, that is so amazing because when you realize you are such an amazing, special individual, it just shows you why like a one shoe fits all approach doesn't work because
Right.
your body is different, your lifestyle is different. And then from there, so like I do this every time. I'm like, we're all so different, but what are some tips? Like, but in general, like, or what are some things if someone's listening and they are having, because it's amazing. We don't, I mean, at Funky, we talk about this a lot, and you talking about a lot about being the menstruation queen on Instagram, but we don't talk about our periods a lot. So, how does that kind of impact, like, say someone is struggling, but they don't know it's different? How do you
Mm.
think the fact that we have a period stigma impacts those diagnoses, or if someone even making their way to you?
Exactly. It's a huge part of this whole story because none of us ever learned what a healthy period is supposed to be. We do go on indefinitely, just kind of dealing with it, like thinking it's normal. But just because something is common doesn't mean it's normal. Just because most women we know struggle with painful periods or severe acne or bloating or whatever doesn't mean that that's the way it has to be. But you're so right, because we don't talk about this, because there's not an empowering container. I mean, like, what education did we get? Some like awkward seventh grade health class where we were all like not listening at all. And it was not usable, right? It was like, here's like your hormones one-on-one. Like, what seventh grader is going to integrate that? Um, that's such a disservice to us, rather than talking about, this is a normal cycle length. This is the normal amount of blood you want to lose during your period. Your cycle should be this long. Here's, I mean, better yet, how to track your cycle, how to know if you're even ovulating, because then people would really have the baseline to know when something is irregular, when to get help, and then they could get that help sooner. So unfortunately, a lot of people, by the time they find me, they're, at a pretty severe end of irregularities, and they've kind of gotten the run around from their normal physicians. So it's hard. Yeah.
Yeah, it is really hard. And I think it's the same. Like by the time someone gets to nutrition, it's honestly just it makes me so sad because I'm like, oh, we could have if we could have gotten this like a little bit.
Yeah.
But it's just because it's like there's so much stigma around talking about health, especially period health. There's this like you have to suck it up mentality.
Mm-hmm.
Like, oh, well, just because you're having your period and you feel terrible doesn't mean you can miss work. Like, oh, that counts against your
Yeah.
vacation days, or.
Yeah, it's bad. It's funny. I just had a conversation the other day with someone about this, and she was a little older. And I think our generation too, we're having just more irregularities than the previous generation. And
Yes.
there's maybe a lot of reasons, but so she was a little older, but she was like, "Yeah, I don't get like why people have so many struggles now. Like I just took an ibuprofen and moved on with my life." And I had to be like, "Oh, well, that's a little disregarding, but some people do have really severe issues and they can't go to work, and that's not really That's not a very kind thing to say. Yeah, to infer that, yeah, just like suck it up.
It's like, Dad, a suck it up attitude. Like, I remember in college, mine would be so bad that I'd like be in the bathtub, like curled up and like
Oh,
couldn't get out. Yeah. And I was like in school learning all about the body, and I was just like, this is just my cycle. It wasn't until I got off, and that was even on birth control. So like,
wow.
yes, it has been there. It's no coincidence I ended up in this field. But from there, like, so you just talked about some really important things. I didn't know how to track my cycle until like 2 years ago. Could you maybe give
Yeah.
some of those tips or things to look out for? Like, how much blood is normal? What's a normal cycle? How would you track it? And maybe what are some signs that maybe it's not PCOS, maybe it's just something else is going on?
Yeah, that's a great question. So ideally, in terms of cycle length, we'd want to see between 26 to 35 days. So if it's shorter than that or longer than that, or there's an irregularity around it, that should be addressed. Our period itself should be 3 to 7 days, but usually when I work with clients, we get it down to more like 3 to 4 days. So even 7 days, I feel like is kind of an extreme sign. You shouldn't have to bleed and be in pain that long. And in terms of pain, anything that's on the extreme side really just has to be addressed. So if it is taking away from your quality of life, if you can't go to work during that first day of your period, if you have to take a midol just to function, those are extreme enough that would indicate something's a little off here. If you're going through multiple pads or tampons a day, that's also a big indicator that it's too much blood. So really 30 to 60 milliliters of blood during our entire period. And for context, the average menstrual cup is 30 milliliters. So if you're like going through 4 menstrual cups a day, that's a little too much. That's probably something estrogen wise that we want to look at. Really, with your cycles, they're the fifth vital sign. So they tell you exactly what's going on within your body. So if it's heavy and painful and you're passing big clots and it's dark, that is such a big indicator about your health. And on the opposite end, if it's really scant and you're bleeding like one day and you feel kind of lifeless or anemic looking, that's also a really big indicator. So cycle tracking is cool because we start to look at the patterns we experience with our cycle. So just with like a free little app on your phone, you can start to plug in, usually day 16 through 20, I do have breast tenderness, or maybe my period is typically this long, or my PMS is really bad these days. And when we see those patterns, then we really have that empowerment to start to get help around it. And then of course, if you work with a practitioner like me, that's going to be my first question is, how long's your period? How long are you bleeding? What are your symptoms like? So with cycle tracking too, I like it because you can then also track when you're ovulating. And if you're ovulating, that's a pretty significant sign of health. So a lot of people, whether or not they have PCOS, are not ovulating from birth control use, from stress, from a lack of minerals, from a lack of healthy fats. And so, yeah, I guess to sum that up, cycle tracking gives you the insights to really see what's going on with your body, and then you can determine if further help is needed.
Yeah, that's why I love it too. It just feels like a very like hands-on approach to where you can know, like, because our cycles change month to month too, depending on what was going on the previous month, 2 months
Yes.
or 3 months before. I know the pandemic's caused a lot of irregular cycles,
Oh
and
my gosh, yeah.
2020 is like any regular cycle, I feel like. It's like always
Basically.
surprising us, like something new every time. Like that's how I felt. Like I didn't get my period for like 6 months after birth control. And
Mm,
like my cycle then felt like how 2020 feels now. Like always something throwing something at me.
exactly. Are we going to spot this month? Are we going to
Yeah.
not have a period? Like, who knows?
Are we gonna ovulate? Are we gonna have cervical mucus? Like what's going on? Is it
Exactly.
coming? Oh, that's like how I felt. But yeah, that's why I don't know. I think I'm really passionate about this because there's so much, it's so empowering when you realize you do have some control over like tracking your cycle and getting a healthcare provider that really listens to you too. Like I
Yes.
think that's so important is, whether it's PCOS or another endometriosis. Oh my gosh, my words today. It's something like I know for me, it's like I went through so many gynecologists who wouldn't listen to me when I knew something was wrong with my cycle.
Yeah.
And the relief you get when you find someone who hears you is like,
Yeah.
I'm
Yeah.
sure you're used to getting that when people make their way to you.
Exactly. Yeah. Sometimes they feel like this is the first time they've ever felt like safe to share all the layers of their healing, and they didn't feel rushed to try and like spout it all out in 5.5 minutes and then inevitably, just probably be handed birth control. So, and like you said at the beginning, these physicians have good intentions, but that's just what's taught in medical school.
And it's like the way our care system is set up. It's so fast. There's so many people. Like, it's just like, I mean, I've worked in healthcare and there's so many layers to it. Like, people go into medicine with beautiful intentions and they genuinely want to help. And
Yeah.
it's just almost like they're not really given the opportunity or the tools, is how I looked at it. Like, when I was in a hospital, it was so hard to find time. I really needed like an
Mm,
hour with everyone.
right. How long did you get?
Oh, 15 to 20 minutes, 5 minutes. I
Wow.
mean, it just depends like how fast it is. And yeah, I would say 5 to 20 minutes was like the average.
Mm.
And that's a lot to learn someone's whole life of eating, you know?
Right, right. Oh my gosh. Yeah, it's when you look at it all, it's like no wonder so many of us are so confused or having so many issues, because it would be a miracle to not feel that way with how the system is set up.
Yeah, it would. And that's what's so crazy. Well, okay, so to wrap up, you can track there's so many things. I could talk for hours, especially like when I meet like, and you probably have so much more knowledge in like the hormone testing area, which I'm so interested in. I feel like I would love to have my panels done like every month
Mm,
before.
right.
Um, but so your wrap up of anyone who's listening who has PCOS or someone in their life has PCOS, what would you tell them?
Mm. A reminder that you are more than your diagnosis. So it doesn't define you, and it doesn't mean you've done anything wrong. It doesn't mean that your body's betraying you, but it is a sign from your body that something needs to be supported. So rather than feeling the anger or resentment or feeling like now you can never be a mom or whatever, I would really encourage you to take the more empowered perspective, which is my body's telling me something and I am willing and ready to listen. So from that viewpoint, healing is possible. And as I said, the symptoms can be 100% managed. So find a practitioner that hears you, cares for you, really empowers you, and you will see some amazing results for sure.
That's so amazing and empowering because, I mean, cycle issues are so emotional and sensitive. And, you know, I've been there too. So it's like,
Yeah.
it's hard when no one's listening and you feel like you're on your own. So that's great that there's so much that can be done.
Yes, exactly.
Well, amazing. Well, thank you so much for coming on and we appreciate it. Before we log off, where can everybody find you?
Yes, I'm on Instagram at menstruation queen, so all things cycle related, and also on my website, CassandraWilder.com.
Amazing. Well, thank you so much. And if you guys have any questions, reach out to her on Instagram. She's great with her DM. She'll get back to you, and her content is really fun. It makes talking about your cycle not so intimidating or scary. So, yeah, thanks for being on, and we'll talk to you guys later.